In the future, there could be an even more important reason to remove immature wisdom teeth routinely, and that is for their stem cells. What are stem cells? Well, they're primitive cells that can be changed into different kinds of cells for repair of diseased or injured tissues. Bone marrow transplants are an example of blood-forming stem cells taken from the hip marrow. Plastic surgeons are now harvesting stem cells from fat to re-inject with their fat grafts to improve the healing of the reconstructed areas. Amazingly, teeth also have stem cells. Dental stem cells can be changed into cartilage or bone-forming cells, possibly many others. Dental stem cells are found in greatest quantity in immature wisdom teeth and the follicle, or the little soft tissue cap that covers the impacted wisdom tooth before it begins to come through the gum tissue. There is now a way to save these dental stem cells with a service that freezes them for possible use later, when clinical applications may actually become commercially available, which I expect to be within our children's lifetimes. So, the teeth and tissue that we routinely discarded in the past may end up being quite valuable to our children's future health needs. But to get the most dental stem cells from the wisdom teeth, you need to remove them before the wisdom teeth break through the gum. Precisely the best time to take them out anyway. Perfect timing. For more information on dental stem cells, go to http://grellnerdds.com, where you will click on the right-hand side a link labeled Where to Get Stem Cells. On this page you can learn much more about stem cells and the exciting possibilities for your child's future. So why use an oral surgeon? There are several different types of dentists who may offer to remove wisdom teeth. Before my specialty training in oral surgery, I removed wisdom teeth as a general dentist, but there were limitations to my skills. What changed? Oral surgeons now typically do 4 to 6 additional years of training after their 4 years of dental school in a hospital where they work as residents in different medical and surgical specialty areas. They also get excellent anesthesia training from anesthesiologists and administer hundreds of general anesthetics in the operating room setting. Oral surgeons are trained to do major surgery on both jaws, which include fixing traumatic fractures, as well as creating fractures to move jaws into different positions, as well as many other surgical skills. It is this familiarity with the surgical anatomy of the jaws and broad surgical experience that enables oral surgeons to handle the difficult surgical situations they run into with greater skill and confidence. With their excellent anesthesia training and experience, the oral surgeon is generally the only dental specialist who is routinely licensed to administer general anesthesia, with the exception of dental anesthesiologists. A particular interest of mine has been that of anesthesia. As a result of working with a new ultra-short-acting narcotic for the past 7 years, I have created an anesthetic technique that provides the best short-duration general anesthesia that I have ever used, what I call quick recover anesthesia. So with the availability of a safe, short-duration general anesthetic like this quick recover anesthesia, there should be no reason to avoid having wisdom teeth removed because of fear of the surgery or the anesthesia. This quick recover anesthesia method utilizes advanced continuous infusion anesthesia, which is much more effective than nitrous oxide gas and far more controlled and effective than orally administered pills or even the traditional IV anesthesia techniques that I used in the past. The advantages of quick recover anesthesia are greater safety and control because the medication doses are tailored to the patient's specific weight and can be adjusted both up or down as needed. Patients are more clear-headed when discharged in as short as 10 to 20 minutes after the surgery is ended. Nausea is rare and there are fewer, if any, prolonged unpleasant side effects from long-acting medications after discharge. For more information, if you haven't gotten enough yet, I've got more. I have a web page that is entitled The Parent's Guide to Wisdom Teeth, in which there is an ebook that I've written for parents of teens. As well, there is a website devoted specifically to parents of teens whose wisdom teeth have not yet even begun to come through the gum. Finally, if TampaWisdomTeeth.com does not apply to your case, my general website is GrellnerDDS.com, where if you have general questions about wisdom teeth, just click the link labeled Wisdom Teeth. It's all about the experience. It's my goal to provide your young adult the best experience that we possibly can with their wisdom teeth. How? Well, we've got an awesome, compassionate, and fun staff. But it's also in the proper timing of the surgery, which is critical to reducing complications and taking full advantage of youth for the easiest possible surgical recovery. The state-of-the-art anesthesia to make the experience relaxing and fun with a short and pleasant anesthetic recovery, as well as using the most effective postoperative pain relief available. As a parent, I treated both of my children in the very same way I would yours. Correctly timing the removal of the wisdom teeth can quite possibly make this experience the best it can ever be in your child's lifetime. And now you know why.